All right, hey everyone, welcome back. We're diving deep today, and it's a big one, a subject that hits close to home for, well, everyone really, mental health in
Yeah,
America.
absolutely.
We've got this really insightful article, Mental Health, Breaking the Stigma and Advocating for Better Care, and we're going to, well, break it down, see what we can learn, what we can do.
It's a conversation we need to be having, that's for sure.
One thing that really jumped out at me right off the bat, this statistic, it said over 60% of people who are dealing with mental health conditions, they don't even seek treatment
Wow.
because they're afraid of being judged.
Afraid to even, yeah, to even talk about it.
Exactly. And that silence, it can be, well, it could have really serious consequences. The article said, and this is kind of scary, untreated mental illness, it contributes to almost $300 billion, that's billion with a B, in lost earnings every year, just in the U.S.
It's a huge problem, and it affects everyone, not just, the individual struggling.
It's not just a personal thing. It's like, it's an economic thing, a societal thing.
hmm
So the question is why? Why is there still so much stigma around mental health? I mean, even with so much at stake.
Well, you got to look at the history, right? For centuries, mental illness was, I don't know, it was like this mystery. People didn't understand it. So there were, these really harmful treatments. People were isolated. Like it was something to be ashamed of.
Right, like it was their fault somehow.
Exactly. And those ideas, they stick around, Even
Yeah.
today, look at how mental health is shown in movies, on TV.
Yeah. Yeah, it's always so dramatic.
It's all stereotypes, and that just makes people even more scared to reach out for help.
It's like we're taught to see it as a weakness, like pull yourself up by your bootstraps, that kind of thing.
It's not a weakness, it's a health issue,
Yeah.
just like any other health issue.
Which brings us to another big problem, and the article talks about this too, funding. It says almost 1 in 5 adults in the U.S. are dealing with mental illness, but but the money going towards mental health services, it's shockingly low. What was the most surprising thing you learned, while you were preparing for this?
The biggest thing for me was the difference in funding between mental health and physical health. It's a huge gap.
Like how big are we talking?
Well, okay, so in 2022, the National Institutes of Health, they gave over $44 billion, 44 billion to research on physical health, things like cancer, heart disease.
Right, right.
But for mental health research, they only gave a little over 2 billion.
Wow, that's a huge difference.
It is, and that kind of imbalance, it affects everything. The treatments that are available, insurance coverage, everything.
So less money for research, that means fewer new treatments, and then people have a harder time getting the care they need.
It's this cycle, and the people who are hurt the most are the ones who are already struggling. People in rural areas, low-income communities, they have the least access to care.
The article called the workplace what was it, a critical battleground for mental health. And I think they're right. They said 80% of workers, 80% are dealing with stress related to their jobs.
Yeah, that number's really alarming.
So what can companies do? The article mentions things like employee assistance programs, but do those really work?
They can help, but it's not enough, not even close. The most important thing is the culture of the workplace. It needs to be okay to talk about mental health, to ask for help without worrying that you'll be punished for it.
Yeah, like it shouldn't be a taboo subject.
Exactly. Imagine a workplace where it's just as normal to take a mental health day as it is to take a day off when you have the flu. That's what we should be aiming for.
That's a great way to put it. So we've covered a lot, this whole idea of stigma, the funding problem, the pressure people feel at work. What do you think is the most important thing for our listeners to take away from all this?
For me, it goes back to something the article said. It was their call to action, and it asked, how can you contribute to a healthier, more inclusive future when it comes to mental health?
That's good to know.
It's saying that change starts with each of us. It can be small things like learning more about mental health, speaking up when you hear someone saying something that's just wrong, or pushing for better policies in your community. Every little bit helps.
It all adds up. I think what we've seen from this deep dive is that, yeah, the problems are complicated, but if we understand them, if we do something about them, we can make a real difference. We can build a future where mental health is valued, where people feel supported, and where everyone can get the help they need.
That's the goal.
That's what we're working towards.